We started Eggleston and Eggleston in 1994. I spent 4 years at KPMG in the healthcare division and really wanted to start a CPA firm that gave physician practices everything they needed to succeed. We offer practice management, accounting, billing and coding, and credentialing and contracting services. Eggleston and Eggleston is located in Roanoke, Virginia. All of our team is here. We're located in one building. We've got the right team, the right culture. We began covering Virginia and West Virginia and quickly expanded to the full mid-Atlantic states. Most of our referrals come from existing clients, lawyers that we've worked with in the past, and then other business professionals. Today we've got 36 practices across the country, and with the advent of Zoom meetings, there's no distance we can't cover. Some struggles we see with private practice, first and foremost, is billing. Lack of denials management is what we see a lot of. We see a lack of focus on renegotiating private payer contracts. We see staffing. Staffing has just become a huge hurdle. You've got to interview well, you've got to do background checks, you've got to have a great onboarding, and culture is so important nowadays. We used to just focus on physician retention, and now our focus is on staff retention as well. Staying on staff, we see overstaffed a lot. And I like to sit down with the providers and say, if we started this over, how would we do it? And we frequently come up with a different model. Another area is medical supplies. Medical supplies creep up over time. I like to institute multiple vendors, group purchasing organizations, and I like to say what gets measured gets done. And when we include everybody in the process, we see medical supply costs go down. And no-shows. No-shows is a big one for me. We see some practices have got a couple no-shows in the morning and a couple no-shows in the afternoon. And the staff and even the providers look at it and say, gosh, what a good break in the day. We had a couple no-shows this morning. Well, 4 no-shows a day is $73,000 a year of lost revenue. My team and I like to implement strategies to take care of these pain points. Staffing used to be easy, and now it's one of our biggest hurdles. Used to be you could hire someone, you'd interview a handful of candidates, hire one, they'd stay with you for 10, 15 years till retirement. And nowadays everything's changed. Finding the right candidate is real work. You've got to just be thorough at your interview process, background checks, onboarding. Culture is so important nowadays. We don't fill a position to fill a position. If we interview 10 candidates and we don't have the right fit, we go back to the drawing board and keep interviewing. And I think that's important. And I'll tell you, with our help, I believe our clients have world-class recruiting. Well, successfully owning and operating a private practice can be challenging, but it's rewarding. The employed physicians don't face the same challenges or have the same rewards that the private practitioners do. I like to sit down with my clients and say, do you want your lifestyle to dictate your income or your income to dictate your lifestyle? And sometimes those are some tough decisions. We've got some clients that coach their kids' sports teams, some clients that are in social outreach. And after our intensive discussions, we set weekly goals. I believe what gets measured gets done. And we offer feedback and keep them on track. Success to me in private practice means that the providers can focus on their patients and we do the rest. Negotiating with payers nowadays is nothing like it used to be. In the early 2000s, I was getting double-digit increases regularly for most of my clients. And nowadays, 3 to 5% is a win. We were dancing in the hallway when we got 3% from a national vendor just last week. You've got to get to the table. We consistently keep going back to the table for our clients. The payers will offer a low percentage of Medicare as their rate and say, take it or leave it. My argument is to tell them why we need it. And it is to retain our physicians and to recruit new physicians to the practice. Because guess what? If the independent practitioner's gone, everybody's going to be in these big groups. And we all know that you pay the big group, the big chains more than you pay the little guy. We get to the table and try to get to yes. And we make our argument as to why we need this money, and they don't want the money, right? They tell us they got to protect their shareholders and they got to protect their CEO's bottom line, and they can't give us any more money. So we frequently will take their low percentage of Medicare. However, we carve out our top 20 codes. We get a multi-year deal with inflationary increases, and a lot of times we've got to end up taking all of the networks, like maybe a Medicare, a Medicaid, an Advantage network that maybe we didn't really want to be in, that we end up taking so that we can kind of close the loop and get the contract. I have a recent example with a Blue Cross client. They were trying to get into Blue Cross for a year, and they couldn't get in. And then we took over in 4 months of negotiating. We couldn't get in that network, and we kept making the pitch about recruitment and retention. And we just hung in there, and we finally got the right person on the call. 40 minutes later, we've got the contract, the client's happy, Blue Cross is happy, and everybody's in network. I want providers to know that we don't give up and we keep fighting for them. Medical billing is real work. It wasn't called revenue cycle management when I started Eggleston and Eggleston back in 1994. And suddenly everybody wants in. EMR companies, national billing companies, private equity. And what we see is a lot of times they quote a low rate, which means they're thinly staffed. And then they don't have the staff to adequately work the accounts. So they either take the easy money, they only work the high dollar accounts, and most of the time they don't work denials. And that leads to low net collection percentages. A lot of times we see around 85% net collections from these large organizations, and ours are consistently at 96.5%. And there's real money being left on the table. That math comes out to about $73,000 per physician per year, and that is real money. I sit through proposals from other billing companies over the years, and they all want to talk about their system, their billing system, and their, how their clean claims and how they do this. And we've got a great billing system, but I'll tell you the difference in billing is people. It's Kathy, it's Angela, it's Alicia, it's Jennifer, it's Paula. It's these people that take care of denials. And everybody thinks they've got a great system and they're going to scrub it and get the claim out first. Goes through first every time. The claims don't go through. We have a lot of claims that kick out, and you've got to work them. And it's a human being behind the claim, picking up the phone, touching it. That's the difference. Well, what makes us different is that we are practice management first and billing second. And a lot of these organizations are just billing companies and just focused on that. And billing is great, but you add the practice management with it, and you see the bumps in the road, and you renegotiate the contracts, and you kind of find where you are. A lot of our competitors are thinly staffed. We see EMR companies, private equity companies, national billing companies, and they come in and quote a low rate, and that means they're thinly staffed, and they don't have the people to work the denials, or they're just taking the easy money, or they're only working the high dollar claims. And that means that providers are leaving money on the table. We see competitors a lot of times with about 85% net collection rates. Ours are consistently at 96.5%, and that comes out to $73,000 per year per physician. So that's $365,000 for a 5-provider practice. So providers are leaving money on the table. I feel that that forces them into not making good decisions sometimes. And sometimes they make decisions to sell their practices and give up their autonomy, when under our solid management, we could save them from that and save them some money as well as save them their autonomy. Well, one of our clients once said that we're like the concierge at the Ritz-Carlton, not the Holiday Inn, but we're worth every penny. So what does that mean? To me, that means we're going to bring in $10,000 per month more to your practice, and you're going to pay us $2,000 more than the other guy. So you come out significantly ahead in that equation. And a lot of times physicians have trouble with that. They want a value, they see that there's a value in a 4% billing instead of a 6% billing. But they're truly not the same thing. I've done this for 35 years, and I follow a lot of bad billing companies, and I see a lot of physicians that have made the mistake to go with the cheaper billing option. You want your billing team to be experienced and fighting for you. If you're paying your billing company 4%, they don't have the resources to fight for you. Well, if you want to get started with Eggleston and Eggleston, you can call us, email us, use the website. I always ask 2 questions. What's your lag net collection percentage? And when did you last renegotiate your private payer contracts? And I frequently get a blank stare or an honest, I don't know. Well, we offer a free practice review. So within 1 week, you will know what your lag net collection percentage is when you last renegotiated your private payer contracts, and a list of other areas for improvement. We empower physicians to make solid decisions. And with our team, independent practices can thrive.